I was sick a lot. I was sick a lot because I probably missed dosage and didn't realize it. I was in the hospital a lot. When they did give me medicine, I didn't take it right. I admit to it. I just didn't understand them, and I didn't have the nerve to ask them the right way of doing it. I just didn't have the nerve to ask them, and I didn't want anyone to know I couldn't read.
We had a child that was physically handicapped that I had to do physical therapy on. I would show up on Tuesdays instead of Thursdays for the appointment. I would be exercising the wrong side of the body.
I had an abscess in a ear one time. Well, I had to fill out forms and I couldn't fill out, so I didn't go. I come back home. I ended up having to go to the emergency room that night because it burst.
Health literacy is the ability to read, understand, and act on medical information. Unfortunately, millions of adult Americans lack adequate health literacy skills. The doctors, researchers, and patients in this video are real, not actors. The situations, frustrations, and complications are also real. Nearly half of Americans have health literacy challenges. Odds are some of them are your patients.
Can you imagine what it's like, you being a patient and sick, and you know that you have limited skills, okay? And you're talking to an intelligent doctor like yourselves. And these people are using words that you really don't know because they're not speaking in layman's term, okay?
Right.
Most doctors are just presuming that everybody's intelligent as they are, and that is just not the case. So what you do, you come out of that room, that examination room with this intelligent woman or man thinking, God, I hope I don't make a mistake with my medicine because I did not understand anything he or she said to me.
The heart of the problem is a disconnect between patient ability and healthcare communication. The average American reads at an 8th grade level, but healthcare information is often communicated at a college graduate level. This disconnect leads to confusion, frustration, and a feeling of helplessness for patients and physicians. While healthcare information can confuse even highly educated patients, those most vulnerable to misunderstanding are the 1 in 5 adult Americans who are functionally illiterate.
Take one capsule.
That's right, one capsule.
One capsule. I don't know what this is. That
Twice?
Twice daily.
Okay.
Okay.
So how would you take this?
When I see it's not on there telling you how to take it. It say take it twice daily, but it don't say what time to take it.
For people with limited literacy skills, the world can be a challenging one. 21% of adult Americans can't read the front page of a newspaper. 48% can't decipher a bus schedule or make sense of a bar graph. The problem is even worse in the healthcare setting where emotions run high and vocabulary is unfamiliar.
Based on our decade of research on health literacy, our research group has documented clearly that patients who have inadequate health literacy are more likely to be hospitalized for their chronic illnesses. And this is regardless of their socioeconomic status, whether or not they have a primary care provider, regardless of how ill they are.
And tell me which one is which and what you take them for.
That looks like my medicine that he gave me for the morning. I take that and the little pill that... Oh, this is this is Lipian, isn't it? Yeah, that's Lipian.
Okay. And what do you take that medicine for?
Don't ask me. He puts me on there, and I just take it.
Okay.
Anything he tells me to take, I'll take it.
Okay. So you trust him?
Oh, you better believe it with my life.
Research has shown that many patients have a hard time understanding basic medical instruction. 26% didn't understand when their next appointment was scheduled. 42% didn't understand instructions to take medication on an empty stomach. 86% couldn't understand the rights and responsibilities section of a Medicaid application.
Do you know what hypertension means, if I asked you what that was? Because when I look at this, I think, well, maybe you have hypertension and I've been taking care of that for a long time.
Hypered? Mm-hmm. Hypered?
Like you're hyper?
Mm-hmm.
What does being hyper mean to you?
That's where you can't be still. You always got to be doing something.
Do you think I think you're hyper and have hypertension?
I don't know. That's what I consider it.
Okay.
It being, you know.
Okay. But you know you have high blood pressure. Okay, but hypertension doesn't mean the same to you. So if I ask you if you have hypertension, you're going to just think, I think you're jumping around on the chair or something like that, something different.
Just being hypered, you know.
Okay. All right. Well, I haven't done a very good job teaching you what hypertension is, because I think you take that medicine for your hypertension, and that's one of the things that I try to work with you on is your blood pressure. And high blood pressure and hypertension, to us, is the same thing.
The same thing.
Yeah.
Low health literacy impacts patients and all aspects of the healthcare system in many ways. In financial terms, patients with low health literacy use healthcare services more often and increase healthcare costs by an estimated $50 to $73 billion every year. The cost to patients can be equally high.
At approximately 30 or 31, I went into the gynecologist and complained about part of this not working correctly. And he said, we can repair that. Great. I didn't ask all the right questions. When I showed up 2 weeks later at the admissions office at the hospital, they put enough papers in front of me. I'll bet there were 5 papers that I needed to sign. Well, I wasn't going to say, excuse me, but I don't read really well, and I certainly don't read fast, and I'm concerned with some of these words. To me, it was lines and circles over sheets and sheets and sheets. And I wasn't going to reveal my sense of stupidity, so I signed everywhere they told me to sign. Never read it. And then a couple weeks later, in the follow-up office visit, the nurse said, how are you feeling since your hysterectomy? Now, I acted as normal as I could. Inside, my mouth fell open, and I thought to myself, how could I be so stupid as to allow somebody to take part of my body, and I didn't know it?
A patient signs a consent form that they don't understand. They undergo a procedure and there's an adverse outcome that might have been one of the risks. There are legal cases clearly showing that these individuals can sue successfully in this setting because they did not give informed consent.
The majority of patients try to hide this. The majority of patients are not aware of it fully. They believe this is their fault, that they don't understand.
If you have a reading problem, you go to the doctor. That can be very scary. It's like a nightmare. You walk in that office, and most people, if you realize the first thing you're going to have to do if that's your first visit is fill out a form. Your heart beats real fast. You're scared. You don't know what to do. You want to turn around and walk out. I have.
You have panic attacks. Did I do it right? Is this done right? Am I imagining things? Do I go back over and check it again? I've caught mistakes that I made, simple mistakes.
It paralyzes your thoughts completely to think that you may say something or something is put before you to read and you can't read it. I mean, you live with that on a daily basis.
People sooner or later will discover, and that is your most greatest fear. What day is it going to be when somebody discovers you can't read and write?
I would get mad about something and blame them that this is not the right place for me, you're not respecting me, and walk out. And it had nothing to do with that. It was just I needed to cover that I couldn't read this. I didn't want them to know that I'm walking out because I can't read.
So you found solutions that sort of make it work and hide the real problem.
Yes.
So that others won't notice.
Right.
Doesn't that take a lot of your time?
Yes.
Doesn't it take a lot of effort for
A
you?
lot. Very emotionally. Yeah.
It drains you?
Yep.
It almost doesn't matter why they're having problems understanding. It's my job to overcome that barrier so that I can get them the information they need to let me help them.
While we're waiting for research to be done on this topic so that we understand the best way to educate patients, we can still use the advice of the true experts, both patients and physicians who've cared for these patients. There are some things that we can do to help this. One, we need to make sure that the environment in which we deliver the care is an open environment and shame-free. Creating a shame-free environment in a doctor's office or a hospital means that there's an attitude of helpfulness by every person there.
When I walk into a doctor's office or a reception room, I would like to be treated as, even though I'm a stranger, that they know me.
Good morning, sir.
Because you're walking into what you might consider a hostile environment. It drops the defense, all the guards are down, the walls are down, the lines of communications are up.
Patients want to be able to feel safe, that they can tell the physician about their literacy skills, about their inability to understand their medical condition, and receive help. Creating a shame-free environment can start with the forms that patients fill out as a screen for health literacy.
First, to identify them, short and quick, a questionnaire. 7 or 8 questions, and these are straightforward questions. I mean, we've really geared it at 5th grade level. And some of them can't answer the questions. But since the form is present on my desk, then I can immediately notice if they haven't answered the questions. So during the interview, I can bring that up. You know, my medical assistant, I noticed earlier, was helping you out with our questionnaire.
Yes, I'm dyslexic, so I have a difficulty in reading.
Yes.
And also with auditory memory. So things that I forget. So I'll ask you to, write them down, or I'll have my husband come in and whatever we discuss, so that I have a memory.
When we hand a patient a form, we don't just hand them the form and then they sit down and we kind of forget about them. So if they're having a difficult time, you can pretty much tell from how long they've actually had the form. If I see somebody sitting with that clipboard in their hand for 5 minutes, then I know that something is wrong.
I take a detailed social history, which gives me information about a lot of things other than just their literacy, their cultural background and approach to health care. How much education they've had is a big question, and I always ask people who have had limited education or say that they have had difficulty in school, I always ask them how happy they are with how they read or how well they read. And often it's as if people have been waiting for somebody to ask them that. And I've gotten a lot of mileage out of that particular question. What kind of work do you do?
I'm a pharmacist tech and a DME technician.
DME?
Durable medical equipment.
Oh, okay. And how far did you go in school?
12th grade.
How happy are you with how you read?
I'm not very good. There's always room for improvement. I'm better than I used to be. It's not my reading that really troubles me, it's my writing.
One of the important interactions that can contribute to a shame-free environment is how you review a patient's medications with them. A very effective way to ensure that the patients understand how to take those medications is to have them bring those medications into the office. It's commonly called the brown bag test. And then I sit down with the patient and say, show me how you're supposed to take these medications.
How did you get from the doctor writing you a prescription for you to getting to where you knew what pill came out of what pill bottle?
I guess, I think what I did is the recognition of letters but not being able to read the word. I could recognize a letter and I knew that would be my accolade. And if they're different colors and different things, that helps. But sometimes because 2 of my pills, accolade and my tranquilizer, are the same, almost the same. They're the same color, but because of the size, I have to put them together to make sure I'm not taking 2 of the same thing. So I try to be very careful. There are times if I don't feel well, if I'm not thinking right, I'm in a hurry, I have taken the 2 tranquilizers instead of 1 accolade and 1 tranquilizer.
If someone can read, they're going to pick up the pill bottle and read the label and tell you how to take it. Whereas a patient who has inadequate health literacy is going to pick up that pill bottle, take off the top, and they're going to look and say, ah, this is my oval little blue pill. This must be my pill for my diabetes.
I think my biggest asset is my front desk and my staff. They're very good at making sure that things happen in a timely fashion, and they can then give me a heads up about someone who they don't think can read.
The second thing physicians need to do is improve their communication skills. When you're trying to ensure patients understand, you can slow down, Don't speak so quickly so that the patients can understand what you're saying.
Well, you're right about the arthritis.
Okay.
It does affect the joints.
Yes.
Patients or anyone can only remember 1, 2, or 3 things from a conversation. Identify what's most important to teach that patient and ensure they understand that before they walk out of the door and go home.
In the form of arthritis that you have, which is the most common, usually what happens is that inside the joint there are 2 bones, at least 2 bones.
Okay.
And the bones are just rubbing off.
Use living room language. Use language that anybody walking on the street would understand, not just a nurse and another doctor.
You mentioned earlier that you were working on your home.
Yes.
100 years old. You noticed my door. It creaks. It wears down. That door has a little oil, so it doesn't creak. When that oil wears off, it starts creaking.
What was interesting is that he used visual aids in the sense of he made a visual picture of what was going on, describing arthritis as being a joint in the door frame and not having oil. So this really helps out in the fact that you have a visual picture of what might be going on in your body.
It doesn't matter whether people are highly educated because this stuff is difficult to understand.
They're not doctors. And since they're not doctors, they shouldn't understand doctors' terms.
I am married to an engineer now, and this man has some health issues, so we are in the doctor's office from time to time. We will walk out of the doctor's office, and my husband, with all of that left-brained intellect, will say to me, "What did the doctor say? What am I supposed to do? I don't understand."
Mary brought in her husband. And it was very clear from the beginning, once they were together, how they have a dynamic that works. And the majority of the things that she does in healthcare, she may not be able to go 100% with it, but he's there to fill in the gap.
I use a lot of posters. I have lots of posters and models, and I think people remember it better if they can see it, or if it's associated to something that they understand already. So I think the models and the visuals all make a big difference.
If the patient comes in with medication, a lot of times they're on so many medications, they're confused on when to take it, what it's for. So we do have a medication compliance sheet. And we do actually tape a pill that they bring in out of their medicine bottle. We tape it to the sheet, we write down when they take it and what the medication's for.
It's really important that you don't say, "Do you understand?" Because they're going to say, "Yeah." And that'll be the end of it, and you won't know what they understand. They may understand, but it may not be what you said. I think I use a teach the teacher mechanism. It's like, now that you know this, I know you've got friends. When they ask about this issue, how are you going to tell them? What are you going to say? Well, one of the things that you can do if you have a really bad pain, I mean where you can't stand on it and it's really getting in your way, is to use what I call, this is my little pain protocol here. It has ibuprofen, which decreases those little cells I was talking to you about, the inflamed part, and your Tylenol that just works on the pain. And the I is for ibuprofen and T is for Tylenol. And this just shows you how to do it over the course of the day. For breakfast, lunch, and dinner, there's an I, so you use ibuprofen.
Right.
Because you have to have something on your stomach.
That's right.
With that one.
Yeah.
Because this one will irritate your stomach.
Yeah.
So in between meals and at bedtime, you use a Tylenol.
Right.
This way you get something every 3 hours. You don't overdose on either one. So it's IT, IT, IT. And if you do that for a couple of days when it's really bad, then you can just go back to your regular regimen. But this usually breaks the pain pretty nicely. So I know you have a lot of friends with arthritis. How would you explain it to them?
Well, for breakfast, I take I. 10 a.m., I take T. Lunch, I take I. 3 p.m., I take T. I at dinner. And tea at bedtime. Is that correct, Doctor?
That's going to work just fine.
Thank you very much.
I think there are a lot of simple things that physicians can do to improve their office and make it a shame-free environment. There's a lot of simple things doctors can do to ensure their patients understand them and ensure these patients have better health.
As we've seen, a shame-free environment is one that conveys an attitude of helpfulness. It's a safe place where patients feel more comfortable and are more likely to reveal literacy problems. Engage the entire staff. And remember, there are clues that indicate the possibility of low health literacy, for example, incomplete forms. Clues can also come from the information derived from the social history and insights gleaned from the medication review. As far as improving communication, keep in mind these simple techniques. Slow down, use living room language, convey only the most important concepts, involve family members, use visual aids, and employ the teach-back method. The physicians you have just seen are using a variety of communication techniques to better inform their patients. As research continues to unearth best practices, we ask you to join them and all of us at the AMA in finding and implementing simple ways to communicate with all your patients. Please let us know what techniques you have tried and what has worked in your practice.
There's no question, when a patient understands how to take their medication, when a patient recognizes that the physician really cares about them, their face lights up. And that is so gratifying to see that in a patient, that they know their doctor cares about them and that they now know how to best take care of themselves.
See the manual that accompanies this video and visit www.amafoundation.org to learn more about health literacy and techniques you can use in your practice.